day, I am Bea Maureen Gementiza from BSN 13B, Group 14, and a student nurse from Davao Doctors College. And today, I will be performing a return demonstration for applying a rigid splint. But before that, I will tell you first what is the purpose of applying a rigid splint. So a splint is a supportive device that is used to keep in place a suspected fractured areas like legs or arms. Also, it is used to provide relief pain of the fractured limbs and to protect the bone from protruding through the skin and as well as bleeding. Lastly, it is used to facilitate safety and seamless causality factors. Step 1. Prepare necessary equipment. We need to prepare a rigid board, triangular bandages, at least 2, or any long cloth that can serve the purpose. Take note also that we need to prepare a gloves in order for us to prevent blood getting on our skin. So as you can see, we already prepared a rigid board, but if you don't have a rigid board, you can use a pillow or notebook. We also have 2 triangular bandages, and of course our gloves. So the use of our rigid board is to prevent any body parts from moving. So our triangular bandages will serve as a dressing or a sling that will support the fractured limb. Step 2. Check if the scene is safe. So before administering help in an emergency situation, let us always check if the scene is safe. This will ensure the safety of our patient to prevent harm for ourselves and to other rescuers. So there are 4 things we need to consider in checking if the scene is safe. So first, check for the unusual noises, check for the unusual sight, check for the unusual odors, and of course to check for the unusual appearances. So since the scene is safe, let's now proceed to the next step. Step 3. Get consent. It is important for us to get the consent of our patient because our patient have the right to make informed decision about their care and treatment. Good morning, sir. I am Bea Maureen Gementiza, a third-year nursing student from Davao Doctors College. I am trained to do a first aid. May I, sir?
Yes, please.
So, step 4, support both below and above of the injury site. So, this will prevent further injury and to minimize the pain during the splint application. So, sir, gunit ako, sir, ha? So, if you were alone, you can ask the patient to support his arm so that we can proceed to the next procedure. Sir, pwede hawirin lang kami, sir. Next is to check for the circulation. We should check for the filling, for the warmth, and the color. So this will ensure that adequate perfusion still reaches the affected extremity. So let's check first the filling. Sir, maka-feel ka?
Yes.
Sir, pakilihok na ko sa imong fingers. Okay, sir. Next, we will check for the warmth. Then, while checking for the warmth, we can also check for the pulse. So, the pulse is good. Then, we should check for the color. So, always remember that if the color is pale, then there's an obstruction in circulation or there's a bleeding. But since the patient's color is pinkish, then it looks good. Step 6. Place an appropriately rigid splint or any padded board under the injured body part. So this will support the injury and to prevent further damage. Next step is to secure bandages. Tie several folded triangular bandages or any available cloth above and below the injured body part. Make sure to knot the splint side so that you will not impede the circulation of the blood. So it should be knot in the side. Ask the patient to support this area while you are going to tie the above injury. So sir, pwede pakisupport diri na area. Again, make sure to tie a knot in the side splint so that you will not impede the circulation of the blood. So after securing the bandages, let us now recheck the circulation. We should check again for the feeling, for the warmth, and of course for the color. So this will ensure that the bandages are not too tight as to block circulation. So check for the feeling. Sir, na kayo ma-feel?
Yes.
Sir, ilihok na yung fingers. Okay. Check for the warmth. While checking for the warmth, you can check for the pulse. So the pulse is good. Let's check for the color. So it looks good. The last step is to proceed to the nearest medical facility or hospital. After we check the circulation, then the patient is now ready to be transported to the nearest hospital. It is important for the patient to be checked up and so that the patient will be given a proper medical attention. So that's the end of my return demonstration for applying a rigid splint.